Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey. It's Medical Monday at East Cooper Medical Center, and today we're sitting down with a colorectal surgeon to learn the signs, symptoms, and treatment options for those suffering from hemorrhoids.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Susan Knoche. She's a colorectal surgeon here at East Cooper Medical Center. Thanks for being here.
No problem. Thanks for having me.
We're talking about hemorrhoids, all right? And I usually think that most of the time that just happens to pregnant women, right?
That's a common thought, but that's not true.
All right, well, let's first start off with what is a hemorrhoid?
Okay, so everyone has a vascular complex or a network of blood vessels at their bottom. Okay, and those are normal and they're there from your birth and they don't ever need to act up necessarily. If they start getting engorged or full of blood and start kind of prolapsing and becoming symptomatic or painful, then we call them hemorrhoids.
Okay.
Okay, and they're internal ones and external ones. There's some inside your bottom or inside your anus and some just right on the outside. And folks who get it can be pregnant, and that's because they have increased weight in their abdomen, more pressure on their bottom, and they're carrying that baby for 9 months and then maybe straining to deliver the baby, and they develop hemorrhoids in that process. But other folks can have it just from being chronically constipated, pushing and straining for years to try to have bowel movements, sitting on the toilet for too long unnecessarily.
Really? How long should you sit on a toilet?
You should sit down, have a bowel movement,
and get up out of there.
That's right.
I agree.
No Facebook, no Twitter.
Yes. It's like, get up out of there.
Don't sit on your phone when you're on the toilet.
I know people who do that.
Yes,
far
that's
too
not
often.
good for your bottom.
Yes.
And also obesity, just because similar to pregnancy, you're carrying a lot of extra weight on in your core and putting pressure on your bottom. And then any jobs that have require a lot of heavy lifting. So if you're a person who moves furniture a lot, or you're just doing a lot of strenuous activity, maybe a weightlifter, sometimes young men who are out there at the gym lifting a lot of heavy weights can develop hemorrhoids as well.
So the reason for the people that are lifting heavy stuff, is it because they're
straining? That's exactly right. So if they're chronically straining, obviously that shouldn't scare people like, oh, I can't move my furniture and I can't move my piano. You obviously can. It's more of a chronic thing, and certain people just develop it, and it may not be preventable in that scenario.
Okay, so it's not like they're going to move a piece of furniture and it's just going to blossom.
Not generally. You shouldn't be afraid to do that.
That's probably not the right word, but
yeah.
Okay, and so how do you treat those?
So hemorrhoids can be treated with just over-the-counter things, pads, wipes, creams, and things like that. And so a lot of patients will kind of manage on their own if they know they have something that's bothering them and it goes away in a few days. But you can also go see your doctor. Your primary care physician can order a steroid cream that can help with the inflammation. And then if it becomes more significant, it's a good idea to come see a colorectal surgeon so that I can be sure you really do only have hemorrhoids there and there's nothing else wrong down there. Because obviously hemorrhoids are not life-threatening. You could live with them forever, but other things can be dangerous. And then we talk about things like banding, which is putting a rubber band on a hemorrhoid, particularly the ones on the inside, and that kills off the hemorrhoid and cures you of the problem. Really? Or an operation to take out all the hemorrhoids.
Because I was just wondering how you handle the ones inside.
The ones inside in the office can just be banded, and it's just a in-office procedure, no pain meds. We sort of strangulate those things with a rubber band and they stop bothering you.
I'm thinking it's like popping a pimple or something. Maybe that's not
quite, but
you said you put a band around it, so that seems simple enough. All right. So what are some of the you talked about this a little bit, lifestyle things that we should?
So I tell folks who are maybe predisposed to getting hemorrhoids, or even if they in general, if you want to prevent having hemorrhoids, have a soft bowel movement every day or every other day. Try not to strain when you have a bowel movement. Don't spend a lot of time on the toilet. You can also use a stool to raise your knees above your hips.
Is that really
that
work?
Can really help. There's something called a squatty potty that can help get your knees up in a more squatting position and allow stool to come out without any straining. So I tell people go get a squatty potty from Target or something, and that'll help with hemorrhoids.
That's incredible, because I didn't know if that was just like a as seen on TV thing, or
No,
if that was
that's
actual
good.
legit.
That's good. It gets your pelvis in the right position for a bowel movement.
Learning something new every day. This is why I love coming to East Cooper. Well, thank you so much for having us.
You're welcome.
And for more information, head online to eastcoopermedctr.com.